A new warning from the U.S. Centers for Disease Control and Prevention about a recent increase in invasive infections of Strep A after at least 2 kids in the U.S. and 15 in the U.K. have died.
NBC7's Amber Frias has more on what parents should look out for.
The CDC says they were first notified about this increase back in November, and I know you're already thinking it, that this uptick in Strep A cases comes just as we're seeing a rise in COVID, flu, and RSV cases in our children. So health officials are urging parents that as we continue to make our way through the holidays, they stay alert and continue taking those precautions.
The 2022 winter season has been a tough one for families, full of sniffles, sore throats, fevers, and trips to the emergency room.
You were feeling really crummy yesterday?
You were feeling good?
No. What was going on? You don't know? You don't remember? Yeah. Did you have a really bad fever? Yeah.
COVID-19, influenza, and RSV have been raging and creating a triple-demic.
It's been going around a lot, so you get kind of worried. You don't really want to go out.
And if that wasn't enough, now health experts are warning parents about another potentially deadly infection, invasive Strep A.
We're seeing somewhat of an increase in the invasive variant of these infections, which are acquired the same way you would acquire a common Strep A infection.
Dr. Schalch Lepe says Strep A is fairly common and can be easily treated with antibiotics. An invasive case of Strep A, however, is more serious.
Those infections progress into more invasive pictures, in other words, affecting multiple organ systems, lower respiratory airways, the skin, and then, causing obviously way more severe disease that in certain circumstances can be lethal as well.
Lepe says the infection is harder on kids. So far in the U.S., 2 kids in the Denver metro area have died. Here in San Diego, there are no reported deaths, but Lepe says he's heard of a few cases.
The emergency room setting and then inpatient side of things, particularly in the intensive care unit, they are reporting.
Overall, the number of invasive Group A infections among children remains low. And according to Dr. Lepe, the condition is rare. And he says there are steps you can take to try and prevent it, starting by making sure you and your family are up to date on your flu and COVID vaccines.
Bacterial infections are actually secondary infections after acquiring a viral respiratory infection. So if you can prevent those, then you minimize the likelihood of these infections sort of coming in.
He says washing your hands frequently, avoiding crowded areas, and avoiding sick people also make a difference.
With those measures alone, I think you're bound to avoid any severe infection and be totally fine for the season.
Amber Frias, NBC7.